So we're talking about Corrective Eye Center, and they there are the leading private ophthalmologist practice in the general Cleveland area. Welcome, founder, Dr. Samuel Salomon. It's good to have you here.
Good morning, Natalie. Thank you very much for having me.
Now, I know one of the big things that a lot of folks deal with when it comes to their eyes is glaucoma.
Correct. First, I must excuse myself and give a shout out to my staff. I've been in private practice in Cleveland for decades, and by far, I've had a good staff in the past. I think I have the most professional, friendly staff I've had in my career. Very proud of them, and my patients love it, and we want that to be a success for them. When they call our office, they'll reach a live, real person, and that starts off the positive. We want to keep it that way. Now, in terms of glaucoma, since around 1980s, we've had a laser treatment for glaucoma, and we have a second-generation laser now. It's over 20 years old, and just now a new study came out confirming decades worth of studies showing that the laser treatment for glaucoma is at least as effective, if not more so, than eye drops for glaucoma.
Interesting. And that's a procedure that's not that scary, it doesn't sound like, if it's a laser treatment.
It's in the office. It takes a minute or two. People drive themselves home minutes later. And 4 out of 5 people, we get an effect as well as any eye drop would. And can be repeated in the future if necessary. I've had some people where it lasts for decades, and some people where it lasts months. But if we can avoid eye drops and the expense, the side effects, the guilt when you forget your drops, which is a really big deal, that's one of the nice things about the laser. It's working 24/7, no matter what the patient themselves does or doesn't do for their glaucoma.
That's interesting. Do you think a lot of patients might not necessarily know that they have this option out there for them now?
It's, for some reason, it's much more true in Japan, Canada, Europe, where the laser is always the first choice. In the United States, perhaps for all kinds of reasons, it's not as well understood. But every eye doctor I know, and I've polled many eye doctors over the years, both ophthalmologists and optometrists, have told me that if they had glaucoma, their first choice would be the laser before eye drops. Now, they themselves might offer eye drops to their patients first. It's like an extra half-a-minute conversation to say, there's a laser option, let's go into questions and details. And we have 2 of these lasers. They're rather expensive. We have multiple offices, and we want to make this available because, again, it's what I would want for myself, so we want for our patients too.
Well, I love that. I love that you have great staff. You're talking about wanting to do what you would do for yourself. I think that probably puts a lot of people at ease when they're coming in because, I mean, let's face it, our eyes are very precious.
People can get anxious about eyes, but they got to ask, and we'll do our best to answer.
So you brought with you a little model here.
Yes.
Of an eye, clearly. Now, what can you explain? Now, I know that there's something else. There's another treatment for, is it cataracts?
Yes. So here's a large plastic elephant, had to give its life for this. But anyway, this is an eyeball, and in the pupil, there's a lens. This lens has been there since you were born, crystal clear like water. With birthdays, it's a nice way of putting it, the lens gets cloudy.
Thankfully, that's not a real eye. We're good.
And it doesn't happen in the operating room. The gravity's turned up. So if the lens goes cloudy, we do cataract surgery for it, and we have to replace that cloudy lens with a clear lens, which is called the implant. And we have implants now that actually can give you near, middle, and distance vision, make you spectacle independent from almost all tasks. That's called a premium implant, and it's been extremely successful and very well received.
So is that even for someone who say they get to their, is it 40s where people say that they start needing the bifocals?
The help. Generally, it's an option. It's generally not what we prefer to do because we'd rather have some pathology we're treating rather than just taking out a lens to avoid other glasses. But some people have really thick glasses, people like me, let's say. I don't have a cataract yet, but I'm almost looking forward because I'm looking forward to that implant. But people who have really thick glasses, whether farsighted or nearsighted, often do benefit in their 40s or 50s from having the lens removed, their natural lens, replaced with this plastic implant, which lasts forever. It has a 70-year track record in the eye. It's not going anywhere. It's like a built-in contact lens you don't have to fool with. What more could you want?
Well, I wear contacts every day, so I would absolutely be hip to that. So you have how many locations? We
have 3 offices, and our surgery center is on the east side. We also work at a surgery center on the west side. Keep people away from hospitals. Hospitals are for sick people. We want to stay away from hospitals.
Well, there you go. There's the website at the bottom of your screen there if you want more information. I'm sure that after hearing that, you might have some questions, so give them a call. Yes. I'm sure your incredible staff that you have there will help everyone out.
And I want to say season's greetings to all, and let's make 2020 the year we all see 2020.
I love it.
Couldn't resist.
You couldn't have done it any better. All right, don't go anywhere. We'll be back after this.